Well, good morning, everybody, and I'm so pleased to welcome you to our 2024 ROMA conference. I had the opportunity yesterday to see many familiar faces and a lot of new faces as well. Many of you have arrived over the last 2 days, and you've traveled by planes, trains, and automobiles. You know how that goes. But however you arrived, we're so glad that you're here. It's hard to believe that we're here together for the 7th ROMA conference. Now, many of you have seen our conference coordinator, Victoria Van Veen, over the years. And Victoria told us, first of all, you need to know she's been our coordinator for all of our conferences. And she said that she had a Facebook memory the other day. You know how they pop up and tell you what happened. For her, it was 6 years ago. And the comment that she made on Facebook then was, woohoo, it's our second ROMA conference, and we've got 800 people and 40 vendors. And in 2024, we have 1,700 delegates and 85 vendors. We continue to grow, obviously, with each passing year, even with 2 of those conferences held virtually. And it's a testament to how important it is to host a dedicated forum for rural issues and opportunities. Our conference hosts hundreds of meetings between municipal elected officials and provincial delegates. Concurrent sessions are focused on topics that are top of mind in rural communities, from economic development to housing to municipal staff retention and recruitment. And it's an opportunity for knowledge sharing and taking what we learn here back to our own communities. Just last year, we held elections. We had a record number of people run for the elected positions of zone representatives. And I think it's a testament to ROMA's growing voice in the province. We also had a 50% board turnover. Some of our new board members were also newly elected councillors in their own communities, sitting at their council tables for the first time. When I tell you that this board jumped in with both feet, I mean it. This board came into their new roles full of excitement and energy, and apparently it continues this morning. They were ready to get to work on behalf of you, rural Ontario. We know ROMA is the voice of rural Ontario, and we must learn and listen to the challenges of our constituents, of you and the people that you represent. We can't depend on others to tell the rural experience. We work alongside our colleagues at the Associations of Municipalities of Ontario on some of the most difficult challenges facing rural governments. Our board advocates through AMO on rural matters to have our say, your say, in provincial discussions that impact rural places. And I'm so proud of the ground we have covered over the past year. Our board collectively shares a passion for building stronger rural communities. We want our rural towns and villages to be places that people are proud to live in, and places that they are proud to come from, and places where they can live and grow. When I think about what it means to be from rural Ontario, I think about all the ways in which our small towns and villages support the vitality of the province of Ontario. 430 of Ontario's 444 municipalities are either rural or have rural communities within their borders. Our industries, mining, forestry, tourism, aggregates, and many more, are important as our family-owned farms and the small businesses that line our streets. Rural communities are rich in history and heritage. Rural people believe in helping neighbors, neighbors helping neighbors. When I first moved to my community after leaving Thunder Bay, I wasn't there a couple of days and people were waving at me. I walked my dogs and people are honking and waving at me. I did not know at the time that apparently there is a Village of Westport wave, and that's just what we do. I thought they thought I was somebody else, quite frankly. It's why we're known for being resilient and innovative during challenging times, the support for our neighbors. And although sometimes we are also known to be a little stubborn and adverse to change, Seriously? Our communities are growing and they are changing in great ways. During the pandemic, we all saw an influx of people moving from urban centers to rural communities. This has made rural Ontario more dynamic and diverse. At our 2023 ROMA conference, we shared our Attainable Housing Task Force report with you. It detailed recommendations to improve rural housing opportunities, and we see evidence that the government has been listening. The full report is on our website. But urban or rural, all municipal governments are grappling with pressure to build more homes. And at the same time, as we heard yesterday afternoon, we know Ontarians are struggling to put food on the table and afford the expenses of everyday life. This is an issue that impacts every one of us. And our research and recommendations impact everyone too. And that is why we continue our advocacy work related to housing alongside AMO. In 2023, our board collaborated with housing experts to further understand the housing needs in rural Ontario. We know that we have to tell the rural story so that people, particularly the government, gets a full understanding of the challenges that we have. We learned about Waterloo Region's managed encampment and how it's helping unhoused people get a foot in the door. And in Prince Edward County, we met with local Affordable Housing Corporation to learn about innovative solutions that they are seeking to build all types of housing in their community. Communities in rural Ontario require a range of housing options to meet the needs of people of all ages, income levels, and stages of life. And this is why we continue to build on our Attainable Housing Task Force. As you know, the ROMA's Board Research and Advocacy on Attainable Housing came out of our 2021 Opportunities for Rural Ontario in a Post-COVID World Plan for Action, and that document continues to guide us. While we know all municipalities are dealing with housing-related challenges, others are facing another type of battle. Across Ontario, municipalities are pushing back against federally regulated railways. These railway companies have started telling municipalities that they alone are on the hook for the costs of installation and upkeep of drains on railway property. Cost sharing for these infrastructure projects has been Ontario law for more than a century. Railways are now refusing to comply with this legislation, and other federally regulated corporations are beginning to follow suit. This has broad implications. So far as we are aware, it has affected more than 30 municipalities across the province, most of them rural. Small municipalities are already burdened with the infrastructure gap, and they simply don't have the tax base to meet these costs or fight against corporations. Quite frankly, for them, it's a David versus Goliath dispute. ROMA's position is that federally regulated industries have a responsibility to pay their fair share for drainage work. ROMA sought legal intervener status earlier in the year in the ongoing dispute between railways and municipalities to do the heavy lifting for rural Ontario. And although there is much more to be done on this case, we will keep you informed. I've been approached by a couple of people that have situations in their municipalities and they weren't aware of this initiative. So I invite you to come to the presentation this afternoon, and we'll make sure that we get you hooked up with our council. All of ROMA's work, the work we're doing today, and the work we are planning for tomorrow requires us to have a defined path forward. So I told you yesterday that we finished the year strong with the adoption of our new strategic plan. Pat Vanini wasn't with us yesterday. Hopefully she's here this morning because she managed, as I said yesterday, to keep most of the pencils out of our eyes. This is an overarching document that will help guide the board for the next 3 years. With many new board members, 2023 was a good year to revisit our vision, mission, and strategic objectives. Having a current strategic plan in place ensures the ROMA board has a clear roadmap moving forward into 2027. As I stated earlier, our Opportunities for Rural Ontario Plan for Action continues to drive us forward. Access to services is one of the 5 themes outlined in the paper, and it was the core focus of our work in 2023. Our consultant, Catherine Woods, hopefully is here today, and she did the research, put together the report I'm going to talk a little bit about now. In particular, we focused on access to healthcare services, including primary and emergency care, mental health, and addiction services in rural Ontario. While we know healthcare is a provincial problem, a provincial challenge, it is one that is increasingly falling to municipalities to manage. We started this research in the spring with a member survey. I mentioned yesterday how important our surveys are. They really scope out our work. And that survey helped the board narrow its focus to the most critical barriers to accessing healthcare services in rural Ontario. Many of you provided important insight, and we thank you for that. This research and other data proved what we already knew to be true. When our healthcare system is strained, rural Ontario is disproportionately impacted. And this is why our report is key to improving access to healthcare in rural Ontario. Many feel that the issues are the same for urban and rural Ontario, but they aren't. Rural Ontario is different. In many rural areas, traveling for medical care isn't measured in minutes, but measured in hours. These services must be brought closer to home. Imagine traveling hours to your closest emergency room, only to find that it's closed. There were more than 600 emergency department closures in rural Ontario in each of 22 and 23. We know from our ROMA members survey that 65% of the respondents said their communities did not have access to walk-in clinics. Some may have a family physician, but either can't get an appointment for weeks or they need help after regular office hours for primary care. So going to the emergency department for medical care is often their only option. In fact, 525,000 people living in rural communities do not have access to primary care. 525,000 of us. Toronto's estimate of residents without primary care is 415,000. And our number is growing by 12% each year. That means that rural Ontarians are losing their doctors 4 times faster than in urban areas. As rural family doctors retire, our informal research shows it takes an average of 3 new physicians to replace the patient load and roster. Many rural communities struggle to attract and retain 1 doctor, let alone 3. Our most vulnerable populations are at risk and have nowhere to turn when they need health care the most. Fixing this and many other issues related to accessing healthcare services will not be easy, but we know it's doable. Municipalities cannot be left to grapple with this on their own. Everyone needs to be on board, including our partners at the provincial level, to make it happen. In 2023, municipal governments were on the hook for funding health service to the tune of $1 billion. Of this, rural Ontarians paid $481 million of property taxes towards health-related services. $481 million for services that 525,000 people currently do not have equitable access to. The rural property tax base was never intended to fund health care. And one of the recommendations the board has made in its report is to upload these costs back to the province. We know the shortage of healthcare professionals is now on the provincial radar. Based on demographics alone, you could likely see this crisis was coming, as in many other professions. We did not see COVID pandemic coming, however. overworking our healthcare providers and pushing many out of the sector into retirement. Long overdue investment in educating and training more healthcare providers will take a decade to come to fruition. In the meantime, we must better use the resources that we already have. This means new and innovative thinking to deploy healthcare professionals in the community to provide more care closer to home. One where the province expands the scope of practice for healthcare providers closest to the people, like paramedics and nurse practitioners. These people are not only skilled and knowledgeable, but they also know the needs of their own communities. They will help people living in their own small towns and villages every day. Imagine if we could bring more primary care to people, to their homes, or to a central community location. We've already seen this in practice. Last year, pharmacists were granted the ability to prescribe antibiotics and treatment for common ailments, but they can do more. And the scope of changes announced recently for registered nurses is helpful. It will allow registered nurses to prescribe medications for things like topical wound care in a variety of healthcare settings like long-term care homes. And for all of you who sits on board of managements of long-term care home, you know how important that is. But they can do more. A more integrated approach to community paramedicine offers the same opportunity. Rural communities have been the leaders in developing creative paramedic programs to help maintain health and reduce the burden on acute hospital services. In this afternoon's panel, we have Chief Nolan from Renfrew, who will talk about some of the things that he did and his staff did during COVID to do exactly that, to provide primary care to people in need. Additionally, we recommend changes to medical transport. That would help free up paramedics to be reallocated to these other roles. Quite frankly, there are far too many examples to list here, but all are focused on delivering care at home or close to home. These are good solutions that reduce pressures on the provincial health services, but municipal taxpayers are supporting far too much of the cost of a provincial service. This is a core issue. The failures of the provincial health system fall into the laps of rural municipal governments in the form of paramedic delays, homelessness, and doctor shortages. People expect our governments to work together. And as the Ontario health teams reshape the way vital services are delivered across the province, it's imperative that rural municipalities have a seat at each of those tables. Only 10% of our ROMA survey respondents said that they were heavily engaged with Ontario health teams. This must change. ROMA's membership wants Ontario health teams to be successful, and they want to be included in the collective efforts and decisions. They want to be at the table when decisions are taken that impact people in their communities. They want to help develop a comprehensive, integrated health care plan for Ontario that provides health care in rural Ontario similar to what is available in the rest of the province. But what it demonstrates is the urgent need for a different approach to health service design, delivery, and funding in rural Ontario. An approach that is innovative, an approach that includes a comprehensive integrated health plan that includes rural municipalities at the table. Quite frankly, using the province's traditional top-down approach implementation of these new ideas will fail. The province must defy convention. It needs to use the policy, regulatory, and fiscal tools at its disposal in new and different ways. Only then will rural Ontarians see a healthcare system that delivers real access to real services closer to home. This transformation must start today. It can start today. Our report and recommendations provide the plan in doing so. So I encourage you to do two things. Please visit our website, roma.on.ca, and review the full report. And for any of you who have delegations with the Ministry of Health this week, consider asking them if they have read the report, and if not, please encourage them to do so. Once again, I'd like to thank you for attending the conference, and we hope you are inspired by new ideas and innovative solutions to the problems we are all up against. There are more than 2.5 million people living in 965 households in rural Ontario. As elected officials and municipal staff, you represent those people. You are the eyes and the ears of your communities. You provide the services to your residents that they most heavily rely on. And we know these people matter. It's not an easy job, and you do it well. I'd also like to reinforce how hard ROMA's board has worked this year. They have stepped up to the plate and stepped into their roles, and it shows. We hope you enjoy the rest of the conference with confidence. And it gives me pleasure now to bring this part to the close, and I would like to introduce Afshan Majidi to the stage to deliver the Secretary Treasurer's report for ROMA. Thank you, and miigwech.